Hello everyone. In this video on child's health, we are going to talk about object stuck in your child's nose or ear. But before that, make sure you've subscribed to our channel and rang that notification bell. Okay. Let's begin. Object stuck in your child's nose or ear. If you can't very easily retrieve an object stuck in your child's nose or ear, the biggest danger is that you'll push it in farther. Safe removal usually requires a trip to the doctor, especially with babies and toddlers. What should I do if my child gets something stuck in his ear or nose? First, stay calm and reassure your child. Don't try to take the object out yourself unless it's right at the surface and very easy to reach. The biggest danger is that you'll push the object deeper. So leave all but the easiest extractions to a doctor, who will have instruments such as tiny forceps. There is one thing you can try at home if your child has something in her nose and she's old enough to follow directions. Have her breathe through her mouth. Press close the nostril without the object. Then have your child gently blow air out of the nostril with the object in it. Hopefully the object will come out. If it does, her nose may bleed a bit. Pinch the soft part of her nose, as you would for a nosebleed. If the bleeding doesn't stop in 10 minutes, call her doctor. If you can't easily retrieve the object, it's important to take your child to the doctor right away. Doctors can see what they're dealing with more easily early on, and some objects become harder to get out the longer you wait. A bean can swell and become more difficult to remove, for example, and a small button battery can cause serious tissue damage. What are the dangers of lodged objects? We've all heard funny stories about babies and small children getting everything from a bean, a button, or a piece of cereal to an insect lodged in their nose or ear. But in reality, this is serious business. For example, an undetected and unremoved object can cause pain and infection. An object can drop from the back of a child's nose into his windpipe. A child can breathe an object from his nose into his lungs. Lodged button batteries can cause serious injury. Is it possible for something to get stuck without my child noticing? Yes. Small children have a fondness for putting all kinds of things, from beads to popcorn kernels, up their nose or into their ears, and they may not realize that something has gotten stuck. Some clues that your child may have an object in her ear: pain or discomfort, redness, drainage, pulling on ear, trouble hearing. Some clues that your child may have an object in her nose: drainage from one side of nose, often with a bad odor, pain or discomfort, nosebleed. How will the doctor get an object out of my child's nose or ear? The doctor will look in your child's ear or nose and then decide how best to proceed. Some possibilities: blocking the open nostril and asking your child to try to blow her nose. If your child can't, you may be instructed to cover your child's mouth with your own and give a short, quick breath to dislodge the object as the doctor closes the open nostril. Using small, tweezer-like forceps, a thin, cotton-tipped swab, or a suction machine to remove the object. If there's an insect in your child's ear, the doctor may use mineral oil or an alcohol solution to suffocate the insect first. Flushing the object out with water, suctioning the object out with a machine, using a magnet to remove a metal object. If the procedure is especially problematic, your child may need to be sedated. An otolaryngologist, ear, nose, and throat doctor may be needed. After the object is out, your child's ear or nose will be examined again to make sure there's nothing else in there. The doctor may prescribe nose drops or ear drops, or antibiotic ointment to nip any infection. How can I prevent this from happening? Make sure all toys are age appropriate. Supervise small children closely. Keep coins and other small items out of reach. Teach your child that it's a bad idea to put anything in his nose or ears. Babies and toddlers can get into all kinds of trouble just by being inquisitive. Child-proofing for your baby or toddler can go a long way toward keeping her safe and you sane. Right? That's all what we got for now. As always, comment below your experiences related to this problem. Leave a like and share it with your friends and family. See you all later. Bye for now.